Morning guys, my name is Robert Ayar. I'm a dentist at Ramsgate Beach, and today we're going to talk about x-rays. And a lot of patients, they ask me, why do we take x-rays and is it necessary, or lots of questions. Well, let me tell you that the reason why we take x-rays is mainly to see what lies beneath the surface and things that we can't see. Just like when you go to a doctor and he tell you, you know what, we need to send you to take some blood tests, and this is just to identify any hidden problems, or like a pilot when he is flying, he need to have data, like about his trip and a lot of things. It's exactly the same thing. It is to see things that is hidden, and we can't see them. For example, if you have a decay that can be seen by the eyes, or a bone loss or whatever, it's easy with the x-rays to detect that, and we can take them for kids and for adults as well. And there are different kind of x-rays. I can probably in the next video I can explain to you the kind of x-rays that we can take. Now, what do we see in actually an x-ray? We can detect decays. We can see if there's an existing decay beneath an existing filling, gum problems, before we do procedures like implants, braces, extractions, root canals, to see abscesses or sequence of eruptions, cysts, tumors. We can even detect the age of the child as well. And a lot of patients, they ask me, well, how many times do we take an x-ray? It depends from a patient to a patient and what sort of procedure he needs. A routine checkup x-rays probably every once or twice a year will be probably considered okay. But if we are going into any procedure, then in that case we probably need to take an x-ray before that procedure, to make sure that the planning and the execution of that procedure will be good. Those days, most of the x-rays are made digital, and that is to say, like if you go to another dentist or something, you can ask to transfer the x-rays, and if it is digital, it's very easy, just like you're sending a file from one surgery to the other. Questions about, is the x-ray safe? X-rays those days, especially the digital ones and what we use in our practice, are extremely safe, to be honest with you, because the amount of radiation is very, very minimal. It is like it's similar to a radiation that you're getting from a flight, 1 to 2 hours in a plane. The only concern is mainly for pregnant women, where we have to do it minimally, and depends on why we're taking the x-rays. So if we can avoid it, we can do that. If not, we can do a minimal amount if she has a problem at that time. A lot of patients also ask me, why are you leaving the room if it is that safe? Well, because we take a lot of x-rays every day. It's not like you guys taking 1 or 2. So another way is that the amount of radiation is going to be a lot by accumulation of the number of the radiation. So that's why we leave the room and to do that. So to me, for better, safe and predictable dentistry, it is important to take the x-rays, and that will save you a lot, because you don't want to have like big procedures that's going to cost you a lot of money. So by checking the oral health and detecting early problems can save you a lot of money on the long run. And in my next videos, I will talk about the kind of x-rays, especially what we have at Ayar Dental that we use, and they are all mostly high-tech x-rays, and how important they are in detecting early problems. Thank you.